That's not to say that there isn't a role for medications and other forms of treatments. I think it's more thinking about exercise as an addition to those other treatments. So, not necessarily replacing other treatments and performing exercise instead, but just adding exercise as an adjunct to current treatments that an individual might be on.
Welcome back to Leg Tech Nation. Today we're going to dive into some research that has taken the internet by storm in the last couple months. Drew, who are we talking to?
We are going back to Australia, back down under. It's been a while since we've had a guest on from the other side of the world. But this week we have Dr. Ben Singh joining us. Ben Singh has his PhD in physical activity and public health, and he is currently a research fellow at the University of South Australia. The research that he does focuses on evaluating the physical and mental benefits of exercise in various populations, and then a specific background in exercise and cancer.
There's a good chance, actually, that you have seen references to his article because it has blown up on the internet. The headlines have been everywhere.
And Joe Rogan.
Yeah, he did. He did indeed get mentioned on Joe Rogan. I don't think his name got said, but the article was referred to, which is as big as it gets in the research world, to be honest. But I've seen a couple headlines that were noteworthy. One news outlet called it the most comprehensive synthesis to date of evidence regarding the effects of all modes of physical activity on symptoms of depression, anxiety, and psychological distress in adult populations. One that's gone a few places. I saw a few different news outlets mention that his research found that exercise was 1.5 times more effective than pharmaceuticals for treating depression, anxiety, and psychological distress. He actually does not totally like that as a headline. It is something that is mentioned in one sentence of the paper, but the research is not actually designed to compare exercise to pharmaceuticals. So that's a really broad generalization to make that he would argue probably needs a little bit more research. There's some interesting takeaways from it. One that was noteworthy, at the time we recorded, the altmetrics score for this paper, which is a score that measures the amount of influence the particular paper is having, was 2,184. Today it is at 2,885. Dr. Singh's previous high for a publication's altmetric score was 60. So we're talking orders of magnitude greater here. And just for a sense of scale, 190 news outlets have picked up this article. It's cited on like 5 separate Wikipedia pages now. 2 publications have already cited it, even though it only came out a couple months ago. 100,000 people have downloaded the abstract. More than 50,000 people have downloaded the full paper. This thing absolutely caught fire. So that is the sheer frequency of times I saw headlines about this article. I knew I had to try and get in touch with Dr. Singh.
And we'll obviously link the article in the show notes. What we're referring to is some work that he and his team did, effectively looking at the effectiveness of exercise and physical health on various ailments, essentially. And it's kind of one of those papers where when you read it, it seems incredibly obvious. Like, of course, getting outside, moving around, these types of things would have positive benefits on things like depression. But, and we have this conversation with him in the podcast, even though it's obvious, there's still a lot of scenarios in Australia and quite frankly here in the US where that often gets ignored in favor of some of the things you talked about, pharmaceuticals, different medications, et cetera. So again, one of the rabbit holes that I think we like to dive down, and I can't think of a better guest to do it with.
And he does, well, we don't talk about too much during the episode. We break down a couple of the nuances, but if you are nerdy enough that you want to crack out the paper, it does provide some interesting breakdowns into comparing different exercise modalities in terms of how they affect different things, comparing different exercise durations, comparing different exercise frequency in terms of days of the week or days per week, intensities, all sorts of things. So it looks at a little bit of the dose response. And it does find in some cases that the dose response is different for different conditions and things like that. For example, resistance was most effective for depression, whereas things like Pilates and yoga were more effective for anxiety. And it's kind of interesting because both of those outperformed aerobic exercise, which if you look at a lot of the literature, it's kind of assumed that aerobic exercise is accepted as most beneficial, but I don't know, maybe it's just easier to study aerobic exercise, easier to standardize aerobic exercise. So maybe that's part of the piece. And we do have some interesting conversation with Dr. Singh about ways that the nature of studying these things is challenging. Do you progress resistance training? Do you not progress it? All sorts of stuff. So there's some interesting nuances, but the overall takeaway being physical exercise, physical activity in general is absolutely a valid, effective method for trying to get positive benefits across a range of psychological conditions.
Enjoy. Having been around research for a long time, like you guys looked at a really comprehensive body of literature, and I just was curious, kind of like what kickstarted this whole thing? Like, what made you guys want to go down this road?
Yeah, so partly it was as a result of sort of the pandemic, especially the period of really strict lockdowns we had. A lot of statistics were coming out to say that rates of depression, anxiety, and distress were increasing worldwide. I guess it was partly due to the pandemic and the lockdowns, but I guess just the trends that have been occurring worldwide. And so with the increased rates of mental health disorders worldwide, we thought it was an important time to try to summarize all the evidence out there, because I guess we've known for a long time that exercise is beneficial for helping improve depression and anxiety. But particularly in recent years, there's been just so many studies published looking at the different types of exercise, the different intensities, and how they can improve mental health symptoms. And so we thought it was just a good time to try to summarize all that evidence into one report, because even ourselves as researchers, when we do try to go out and find some key studies or some key resources, there's so much literature and so much research out there. And we just thought it would be quite an important project to try to summarize all that into the one review.
You mentioned that, I mean, it does seem exceedingly obvious, right, that exercise would have positive effects, on all these types of things. Was there anything that stands out? And I think we'll dive into some of the weeds on this later, but just off the top, like when you guys started looking into this, was there anything that stood out to you as surprising in terms of, hey, this particular thing has this effect, or this doesn't have this effect, and we thought that it might?
Yeah, I think most of the findings weren't too surprising. I think we had a fair idea of what the evidence says. But I think being able to review so many studies, we were able to identify just some key findings. And I guess if you think about some of the key findings, we can go into them a little bit later. But just a few of them that sort of stood out was we found that the higher the intensity the exercise was, the more beneficial it was. So basically, we found that any intensity was effective. So whether it's low, moderate, or vigorous or high intensity, they were all effective. But we noticed that exercise did become more effective the higher the intensity, which is important because I think we've all sort of spoken to people, or we all know people who have been exercising for a long period of time, and you sort of ask them, oh, sort of what do you do? And they say, oh, I just go for a 60-minute walk each day. And you find out that they've been doing the same intensity for the last 5 years. And so what the evidence suggests that if they want to continue experiencing benefits, we know that exercise has to be progressive. And so instead of going for a walk at your usual walking pace, the evidence suggests that perhaps we need to increase that to a brisk walk or even a jog to continue experiencing those benefits. And I guess that sort of comes back to just the general principles of prescribing exercise, that progression. So we found that the intensity was important. And we also found some interesting findings for specific types of exercise. So we found that resistance exercise, so lifting weights, that was most effective for improving depression, whereas Pilates and yoga was most effective for improving anxiety. So we did find some effects of different modes on different sort of mental health conditions. That was a bit of an important finding because I think there's been that general sort of consensus that aerobic exercise is the most beneficial. I think people have sort of thought that for a long time, but I think in recent years, we've seen a lot more studies looking at different types of exercise, so resistance exercise and yoga and Pilates in particular. But again, I think the key take home is that, particularly for mental health symptoms, that just any type of exercise or any type of physical activity is important. So if someone enjoys a particular exercise or they want to avoid a certain type of exercise because they find it unpleasant or they don't enjoy it, then again, we want to be catering to those individual needs and recommending exercises and activities that they're interested in. So they were just some of the key findings that stood out. And I guess overall, our findings supported in terms of exercise for mental health symptoms. The findings supported sort of the current international and national physical activity guidelines. So just generally aiming for 150 minutes a week of sort of any type of physical activity tends to be most beneficial. And that can sort of be achieved by aiming for about 5 days a week and about 30 minutes each of those 5 days. So yeah, it's sort of just reinforcing what the international and the national physical activity guidelines. So they were just sort of some of the key findings that really stood out and were novel components of this research.
So I got to ask a methods question before we dive into some of the specific findings like that. Your piece talks about kind of how you account for overlap between different metas when you're looking at metas that might have covered the same RCTs and things like that. And I ended up, as I was reading your piece, going down kind of a frustrating rabbit hole that you might be able to like help explain to me a little bit.
Yeah.
The piece points out that there was one particular study on sessions less than 30 minutes showing those short sessions being not particularly effective. And I went on a hunt to try and find that particular study. But the initial reference points to a paper by Lynette Craft and her team in 2012.
Yeah.
And then that points to another meta-analysis by Rethurst in 2009. And then that in turn points to a fourth meta, once again by Lynette Craft, this time in 1998.
Yeah.
And that just kind of epitomized to me that there's a lot of metas looking at the same trials in this space. I'm just wondering how you deal with that, because that immediately frustrated me.
Yeah, that's sort of one of the limitations of doing a systematic review of systematic reviews. You're so far removed from the individual randomized control trials. And again, that was sort of one of the reasons why we thought, because there's so many studies out there, we thought it would be quite difficult to analyze the actual RCTs themselves. So that's why we wanted to review the reviews. But I think the key take home there is there was only one study that specifically involved sort of those shorter sessions. And I think we can't really be as confident in the findings when there's only one study showing that. And that was sort of less than 30 minutes. But I think overall, we were sort of pretty confident that aiming for around sort of 30 minutes a day is just sort of a nice sort of place to begin. But in terms of the overlap in the studies, we found that there was quite little overlap because we were looking at a range of different populations. So we had studies involving women with breast cancer, people with HIV, people with diagnosed mental health conditions, depression, schizophrenia. And so the fact that we were looking at so many different populations, it meant that there was little overlap, because we included a systematic review that specifically looked at women with breast cancer. And then we had another systematic review, for example, that involved people with HIV. And so those two systematic reviews, because they're looking at two different populations, they would have no overlap in their included studies. And so that sort of worked in our favor. But again, it is one of the pitfalls of a systematic review, is that you're just so far removed from the individual RCTs. And often each RCT has a handful of limitations, whereas when you're doing a review of reviews, it's hard to sort of go back to what those initial limitations are, just again, because you're a few steps removed from the actual individual studies themselves. So yeah, that was something that it wasn't so apparent when we first came up with the idea for the project, but when we started reviewing the reviews, then we found out that this is becoming a bit of a problem. Like, it's very hard to analyze all the ins and outs of each RCT. So that was all sort of part of the learning process. But I think it sort of doesn't really take away from the overall message that basically any type of physical activity is beneficial for people experiencing mental health symptoms.
Maybe this is jumping to some of the findings. I don't know. It's just something that struck me when I was reading it, because you do, I think in human performance, you do hear about, kind of the dichotomy, low intensity versus high intensity. And obviously the high intensity camp thinks they're the best and low intensity thinks they're the best.
Yeah.
And you guys mentioned that higher intensity, and you said it here, that it's more associated with greater improvements in the symptoms. And reading that, do you think that there's a ceiling to that? I think the obvious answer would be yes, but like I could see someone taking that finding and saying, if I crank it to 1,000, I'm going to get a better outcome. So do you have any sense that there might be a ceiling to the intensity, or is there a sweet spot?
Yeah, there's definitely a sweet spot, and I think it comes down to sort of the individual as well. So, particularly, we know, maybe going back to performance, that if someone wants to enhance performance for a specific sport or a specific task, then the exercise needs to be very individualized and targeted. Whereas for a lot of the studies, we found that people were sedentary. So just going from sedentary, just starting with something. So if someone's never done any exercise or physical activity before, for that particular individual, it might be best starting at a low intensity. But then over time, I guess we want to increase that, progressively increase that. But yeah, I think that definitely is an optimal sweet spot. And we actually saw that with the duration. We found that doing up to about 150 minutes a week tended to lead to the optimal benefits, whereas doing sort of excessive amounts the benefits tended to wear off. And definitely the same would go for intensity as well, because particularly people who might be experiencing severe depression, vigorous exercise might be the last thing on their mind. And we never want to push them to a point where it's unpleasant and they're not enjoying it. We want to find that optimal intensity of exercise for that particular individual. So there definitely is the research suggests that sort of high intensities was the most effective, but I think we sort of need to go back to the individual and on a sort of one-to-one exercise prescription basis, what might be optimal for that particular person, given their sort of circumstances, their previous exercise history, how severe their symptoms are, and also just what their interests are. So they might just have no interest in doing high intensity interval training or high intensity aerobic training. For them, it might be sort of a different type of physical activity. So maybe a sport, could be playing football, could be cycling, or maybe just riding their bike at a sort of lower intensity. So again, yeah, so the evidence suggests that, yeah, higher intensities do lead to greater benefits. But again, I think we need to always remember the individual that we're working with.
Well, and I'm glad you mentioned that, because again, you mentioned a little bit of this about the differences in Australian healthcare systems versus American healthcare systems, and prescribing things holistically versus pharmacologically. And
yeah,
with my background being in strength and conditioning, and you guys looking at exercise as a prescription for mental health, it kind of opens up this thought process and maybe this conversation around, like, maybe there's a role for a strength and conditioning specialist or somebody who has a better understanding of exercise in this healthcare discussion. Because when I think, again, people know, you would think that exercise is good for mental health, but you might see a doctor who just says, oh yeah, hey, like go run, for 150 minutes a week, like you said. But I go back to the point you keep making, which is it needs to be individualized. It needs to be progressive. It seems to me like there's a role to be played for somebody who can, take that patient care over and start to prescribe exercise. And I guess I'm curious as to, one, your thoughts on that, but then two, with the research you guys did and your discussion on the Australian approach to healthcare, like, what does that look like to be in a system that does arguably take that holistic approach as the first step versus just saying, here's a pill?
Yeah, it's an important point. So going back to sort of the doctors, yeah, they sometimes do recommend exercise, but as you mentioned, it's just a very broad recommendation. So instead of giving someone an individualized exercise program, often they just refer them back to the National Physical Activity Guidelines saying, you need to aim for about 30 minutes a day. And then they just sort of set them off on their own. And we know people who are experiencing mental health symptoms or depression, or they're diagnosed with depression or anxiety, that they really require, they often sort of lack the motivation to sort of go out and do things on their own. So they really require that support from a health professional. And so that's where, sort of going back to the strength and conditioning specialists or any sort of health specialist with specialized training in exercise prescription plays an important role, because individuals often do need that support. They need to be working with someone to sort of provide them with the guidance on how much they should be doing, what intensity they should be working at, learning specific exercise technique as well. And so our review, so we looked at studies from all over the world, and there was quite a range of different approaches that we used to deliver the exercise interventions. And sort of not all of them involved an exercise professional. So there was a range of different health professionals that were involved in prescribing that exercise, ranging from sort of exercise physiologists with sort of training in or high degree training, physiotherapists, and a few others. But the key point is a lot of them hadn't received specialized training in exercising with someone with a diagnosed mental health condition. So I think that's also a bit of a gap in how we provide exercise services to people with mental health conditions. Is often it might be someone who's trained in strength and conditioning or exercise prescription, but they haven't received specific training in working with individuals with a mental health condition. And so that's probably an area where there's more training to be done and more sort of research to be done to ensure that if someone is diagnosed with whether it's depression, anxiety, or schizophrenia, or any other mental health condition, that they are working with someone who has experience in prescribing exercise, but also experience and appropriate training in working with people with mental health conditions. But I think going back to the strength and conditioning, again, that's an important point, because we know, like I said, the evidence suggests that the exercise needs to be sort of prescribed in a manner that's tailored to that individual. So really providing someone with access to a health professional or an appropriately trained individual is sort of key in ensuring that they take up the exercise, ensuring that the exercise is appropriate for them, and ensuring that the exercise is safe as well. Because when we're prescribing exercise for someone, we want to be experiencing the mental and the physical health benefits, but we also want to be ensuring that that exercise is being performed safely as well.
Mm-hmm. So I got to ask a quick question, and you mentioned this explicitly in the paper. You compared the Australian approach to kind of the American approach in terms of recommendations and whether pharmaceuticals or lifestyle comes first and things like that. But there was kind of an implied question in the way you guys talked about it, saying that even though Australia recommends interventions like this earlier, in practice, that's not always exactly what happens. So I'm curious, since you're there in Australia, does Australia live up to their guidelines of trying to focus on lifestyle stuff first, or is that not always carried out in practice?
Yeah, it's not always carried out in practice, I think, because ideally it is becoming more and more, or the importance of exercise is sort of becoming more and more important, and people are really starting to recognize the benefits of exercise. But again, I think going back to sort of medications, for example, so if we go back to someone who's experiencing severe depression, they've never exercised in their life, and they're having trouble sort of getting out of bed, they lack motivation to do their day-to-day activities, often exercise is the last thing on their mind and something that they really don't want to be doing. And in those instances, you can really understand why they might sort of lean towards taking medication, because it might be seen as a much more simpler fix. I mean, just taking a pill to help improve their symptoms for particular individuals might just be a much more manageable and an easier approach. And prescribing exercise in clinical settings can be quite difficult. And With medications in particular, so there are a lot of individuals that do benefit from taking medications, but I think we need to be aware that often the medications have quite a lot of side effects, short-term side effects, and often the long-term side effects are unknown. And so I guess that's why exercise is extremely appealing, because there's sort of little to no side effects, and there's tremendous additional health benefits in addition to the mental health benefits. So yeah, in Australia, lifestyle changes are sort of recommended, but still the prescription of medications for mental health conditions is still sort of quite high. And I think where it's just going to take time for exercise to slowly be embedded as a standard component of treatment. And that's not to say that there isn't a role for medications and other forms of treatments. I think it's more thinking about exercise as an addition to those other treatments. So not necessarily replacing other treatments and performing exercise instead, but just adding exercise as an adjunct to current treatments that an individual might be on. And so, yeah, like I said, the benefits of exercise have been known for quite a long time. I think it's just going to take time. And I think we're moving in the right direction. There's more research coming out. People are becoming more aware of the benefits of exercise. And it's, I think, just like anything, if you want to make a change, it takes time. And there's often a lot of resistance to begin with.
Yeah. I mean, it's so one of the things you guys mentioned, which seems counterintuitive maybe as I was reading it, but you talked about how the effectiveness of the intervention, the physical activity intervention, kind of diminishes for longer duration interventions, which to me seems, again, kind of counterintuitive. Why do you think that is?
Yeah, so that was an interesting point that we sort of thought about a bit. So we think that when someone starts an exercise intervention, I think we've all experienced though, when you first commencing new exercise or a new training program, those immediate benefits that you achieve when starting the program. So particularly from a mental health perspective, it seems like if someone's not doing any exercise and they start exercising for the first time, they experience large benefits immediately upon commencing that program. And then over time, we saw that effect diminished. So we saw the optimal benefits were up to about 12 weeks. And then 12 weeks, the effect started to taper. And so I think we don't want people to get the wrong message. We don't want them to think, oh, I just need to exercise for 12 weeks and then stop. We want people exercising lifelong or long term, because we know all those additional health benefits that are associated with long-term exercise. So what we sort of saw was they achieved the optimal benefits after about 12 weeks of consistent, regular, structured exercise. And then continuing exercise just helped them to maintain those benefits, because I think the concern is if someone exercises for 12 weeks and they see improvements in their symptoms of depression, if they stop after that 12 weeks, often the symptoms will return. So that's why we don't want people to get the wrong message and take away from our paper that people just need to be exercising for the 12 weeks. We really want that lifelong exercise, because that will help to maintain those benefits that they did achieve during that initial period. And we think one of the reasons we observed that is perhaps due to dropouts in the study. So, for example, comparing a 12-week study to a year-long study, you're going to get more people drop out in the study that's 12 months long. And also we think it's perhaps due to the exercise prescription that was used in the longer-term studies. We had a look at a few of those studies, and often they didn't continuously progress their exercise. So they just gave people an exercise program for 6 months or 12 months. And often after about that initial period, there was no progression. So there was no increases in duration, no increases in intensity, and no sort of changes in the different types of exercise. So we think that the longer term studies just had less progression in their exercise prescription variables. And that we think might have led to a diminished effect, because basically people were doing the same exercise prescription for 6 to 12 months. So there was a few different factors we think are sort of leading to that result. But again, we don't want people to just going back to what I said. we don't want people to get the wrong message of just exercising for 12 weeks. The way to look at it is after 12 weeks, they can experience sort of optimal benefits. And then if they continue exercising longer term, then they'll be able to maintain those benefits in mental health symptoms.
In terms of optimal benefits, was that just sort of a reduction in kind of self-reported symptoms and things like that? Just a general sense of being in a better place?
Yeah, so there was a wide range of questionnaires that we used across the studies that measured symptoms of depression and anxiety. So a lot of them were sort of on a scale of 1 to 10. How depressed do you feel today? To more sort of formal and extensive questionnaires, which just have multiple choice questions. So yeah, that was self-reported, and we just saw that after about 12 weeks, we saw the largest, or up to about 12 weeks, we saw the largest effects. And then those effects tended to reduce longer term. And I think going back to the exercise prescription variables, it really highlights the importance of changing up the exercise prescription. So not just giving people the same exercise at the same intensity, the same duration for long periods of time. They really need to try to adjust the intensity, maybe change up the type of exercise. So if they were just doing stationary cycling for 20 minutes, then maybe adding some interval training or some sort of variation or adaptation to that. And again, that goes back to what you were saying before in sort of working with maybe a strength and conditioning specialist, because we know if you're working with someone who's trained, they'll be able to provide guidance on how to safely and effectively progress the exercise prescription over long periods of time. So they're not just stuck doing the same thing for sort of 12 months and longer.
Mm-hmm.
This isn't necessarily a question as much as an observation, but I went to some like very different literature to confirm it and make sure I wasn't off track here. But the almost identical phenomenon occurs with pharmaceutical interventions for mental health. You're talking like a third plus of people, you'll see declining efficacy of pharmaceutical interventions after a similar period of time. Sometimes it happens kind of like randomly many years later, where like breakthrough symptoms occur and the pharmaceutical stops working. So I think it's important for people to keep in mind as they see things like this, where like it's not a miracle solution, right? Like we're not going to solve everything with one intervention, but it's basically being compared to pharmaceuticals as the primary options that providers can offer to somebody. And pharmaceuticals have very similar drawbacks in terms of losing efficacy over time, or maybe not holding up quite as well unless you try something new or provide variety or whatever it is.
And yeah, it's a good observation. And that's often where sort of doctors might, when they find that the medications are becoming less effective, just increase the dose of that medication. And that can sometimes be problematic because if there's side effects associated with taking that medication, then if they're increasing the dose, then that can result in more side effects, especially longer term. There's side effects that are unknown. And I think that really highlights the sort of importance and the power of exercise, is that it can constantly be adapted. It's not, and there's sort of an unlimited number of ways that you can sort of adapt and progress an exercise program, changing exercises, intensity, duration. So yeah, definitely a key point.
Well, I think too, it speaks to kind of what you mentioned earlier, which is, and I don't want to say that there are no negative side effects for exercise, because I'm sure somebody could come up with one of them, but
yeah,
definitely with pharmaceuticals, like you mentioned, if you just keep piling more and more on, you increase the risk. But with exercise, you pile more and more on, and arguably it becomes a pretty good thing. So again, not a discussion necessarily on pharmaceuticals, but it's certainly a point to consider if you're sitting there prescribing, hey, this bottle of pills versus this 150 minutes a week exercise prescription. One of the things I did want to ask you, because you guys do have such a robust inclusion criteria. I mean, you looked at a lot of different things, essentially. Do you guys think that there was a population or a diagnosis or a condition that you might have left out, or do you think that there might be a population or a condition that maybe physical activity has no effect, or maybe even a negative effect?
Yeah, it's a good point, a good observation. So we tried to include all studies that assessed any outcome of mental health symptoms. But what we found was, when we were looking at the studies, is that particularly those studies that involved individuals with depression and anxiety, those individuals tended to have sort of very mild symptoms. So there was very little evidence on people who were experiencing severe depression or severe anxiety. And that sort of, it makes sense if you think about it, because if you think about a exercise study, the type of people who are likely to volunteer and participate in an exercise study tend to be the ones who are motivated and might be experiencing mild symptoms. Whereas if someone's experiencing severe depression and they're struggling to get out of bed and they lack motivation to do their daily tasks, they're very unlikely to put their hand up to volunteer for an exercise study. So it's the people who sort of need exercise the most tend to be the ones that don't volunteer for exercise studies and are underrepresented in the research. So that was something we identified when looking at all the different studies, is that I guess those ones that need it the most tend to be the ones that aren't represented or aren't willing to volunteer for an exercise study. So I think that really highlights the need for future research to try to specifically seek out those individuals and get them to participate in an exercise study. But we did find a large range of populations. So we found that there were benefits in not just those that were diagnosed with depression and anxiety, but we did see improvements in a whole range of different populations. So, for example, individuals with HIV, women with breast cancer, and a whole range of other conditions. And we also found that it was beneficial for people who didn't necessarily have a diagnosis of depression or anxiety, but just individuals who might throughout the week just might have, or throughout the month, just might have a day or two where they just feel a bit down and just experience mild symptoms. So I think that really highlights that for individuals with a diagnosed mental health condition, exercise can help to improve those symptoms, but also for people who aren't diagnosed with a mental health condition and maybe experience very mild symptoms on the odd occasion, exercise can help prevent the onset of depression and anxiety. So it can help sort of treat symptoms, but help prevent treatments in those who are not diagnosed. But yeah, going back to the question, definitely there is an underrepresentation of those with very severe or worse cases of mental health conditions.
Well, this is a bit of a pivot, but you kind of raised the conversation by addressing who has the propensity to volunteer for an exercise study and things like that. And I'm going to connect this to kind of our subject matter with the tactical and military environments in a second. But do you think that the individual's perception of physical activity, their perceived like competency in exercise and things like that, do you think those play a significant factor? And the twist I'll add to make it military specific is for those in military environments, they might not choose exercise. They might perceive it as a punishment sometimes. So as militaries, especially in America, but around the world, are reckoning with mental health concerns among service members, I wonder if there's a conversation about like the perceived aspect of it, whether it's perceived as a punishment, whether it's perceived as work or a task they have to perform that they did not volunteer for, whatever it may be.
Yeah, so I think, so particularly people who might not have ever exercised before and they are diagnosed with a mental health condition, then we know that working with a trained professional does help sort of build their confidence and their sort of skills. So often just starting slowly, working with a professional helps sort of build their confidence and their ability to sort of exercise independently. But yeah, and going back to sort of your question about the military, I think so. I sort of don't have as much experience in this field, but definitely, I think it's a combination. So I'm sure that there definitely are individuals in the military who might view it as a punishment or sort of have different views on exercise. But I think, yeah, it's so. Just rephrase the question for me for a second. So it was.
Yeah, I mean, you've kind of gotten at it already, but the people in the studies you are looking at are inherently people who raised their hand and said, I would like to participate in a study that looks at whether exercise can help me, which tells you a little bit about their bias going into it. And if we try and use this as an intervention for anybody, we might see different results if it's not people who thought this might be great in the first place.
Well, I mean, I guess I just wonder too, because having trained a lot of different types of people, you do sometimes get folks that have some anxiety. I mean, I wouldn't call it necessarily diagnosable, but they get anxiety around exercise, especially like you mentioned, somebody who's maybe new to it or has some preconceptions. And so I guess it's just an interesting, I don't know if I would jump so far as to say it's like a contraindication, so to speak, but like it's an interesting thing to consider. If on the one hand we do say, hey, decreases anxiety, decreases depression, maybe you do have to get over that initial hurdle of it might cause some anxiety, as you start to set off. So I guess to kind of pigeonhole that into another question for you, and you may have mentioned this in some of the studies that you looked at, but did you guys get any sense that somebody's training history or their physical background plays a role in how effective the physical activity is? Like if I come into this, and I've got anxiety, but I have a really robust training history, does that change the way that we might go about doing this versus somebody who might be very new and might get a bigger impact from, some longer duration, lower intensity type stuff?
Yeah, so a lot of the studies that we looked at, the individuals were sort of not previously trained. So a lot of them were sedentary or didn't have much exercise history to begin with. And in terms of the anxiety, so it's definitely an important point. So I think if someone it might be causing some anxiety. I think once they sort of start exercising, we know that the benefits can be achieved relatively quickly and in the short term. So I think just providing them with a program that's achievable and not sort of beyond their reach and not too unpleasant or vigorous for them. By doing that, I think immediately or in a short amount of time, they will be able to experience the benefits. And then I think once they can experience some benefits and realize how beneficial exercise is for them, it'll just help build that momentum and help them continue it long term. Because I think we've all experienced those days where we've been maybe either feeling depressed or stressed, or we've got a lot going on our mind, and we just go out and go for a run or lift some weights. And then immediately after, just having that improvement in mood and that reduction in stress. And then that sort of helps reinforce how important exercise is and makes you want to sort of continue it longer term.
Mm-hmm.
So I think for those individuals, it is particularly important to begin. Like I said, most of the studies involved people that were untrained to begin with. So even just a 10 or a 15-minute walk at a brisk pace was something that sort of helped them improve their symptoms acutely, and then building up on that over the long term.
Mm-hmm.
I got a quick sidebar question here, because you kind of got at something I was wondering earlier on when we were talking about session duration and things like that. The reason I keyed in on the finding that shorter session duration didn't appear to have as large an effect, at least as in the studies you looked at, is because I know, like from personal experience, I played with this a little bit, and I've kind of tried to keep track of the effects of different kinds of workouts on my mood, at least. Not to conflate mood with mental illness, because those are two different things. But I have found if I had to identify that type of workout that has the most dramatic effect on my mood, it's like 20 to 30-ish minutes, a real short but high intensity interval training kind of bout. I should correct myself because people are going to come after me on this one. Not the formally defined high intensity interval training. I like the one I found most effective, frankly, was 60 seconds on, 2 minutes off, running intervals, like really straightforward, really simple.
That's what puts you in a good mood.
Intensity work, decent. Like every time it worked pretty well.
Ugh.
And like not quite full effort, but like pretty hard effort. I found a lot of goodness coming from that in terms of like energy levels and mood afterwards. That's why I kind of chased that rabbit hole. And I don't know, that wasn't a question. It was just
he's looking for validation for sprint intervals, Ben. That's basically what he's getting at.
Yeah, I think just going back to what we said earlier, so the reason we found those shorter durations less effective was not necessarily because they were less effective, but because there was less evidence on those shorter durations. So again, like you said, it comes back to the individual and just experimenting what works for you. So someone might find that 90 minutes a day of exercise is what they've got to do to help improve their mood. Whereas for other people, so that might be 90 minutes of lower intensity. That might be optimal for one particular individual. Whereas, like you said, for you, it might have been sort of those shorter bouts at that much higher intensity. And again, I think that's sort of what I sort of found with my own training is a lot of it is just trying out different things to find out what works for you. And it's a combination of what's most effective in terms of what helps your symptoms, what helps your mood or your levels of depression or anxiety or whatever it might be, but also what you enjoy. So if someone enjoys 2 or 3 hours of bushwalking and that's what they want to be doing, then again, we need to sort of meet them where they're at and work with that. Whereas if someone just wants to do 15 minutes of high intensity training a day because that's what they enjoy, then again, it's a combination of what's most effective for that individual and what are the activities that they want to be doing.
I can tell you that as an American, the idea of bushwalking probably induces anxiety for me because I've never been to Australia, caveat, but I just assume and have heard that like everything down there wants to kill you. So like if I were just to go out in the bush for 2 hours, I'm dodging, in my mind, kangaroos, snakes, massive spiders. No question there, just more of a commentary on how dangerous it might be for me as an American to go bushwalking for 2 hours. But I think
I've heard that from every American that I've spoken to has said that. They're like, doesn't everything kill you?
Everything kills you, and there's nothing soft. Like it's all just like spiky and hard and scary. And then you guys are all just like absolute badasses for living in that environment. That's what we think of Australia. This might be an unanswerable question, quite frankly, but do you think that like maybe there's a chance that we talked about folks who volunteer for these types of studies. We've talked about, you mentioned a lot of these folks were untrained. Might it be that people that are training just maybe aren't as depressed and anxious and then therefore wouldn't be involved in this type of study in the first place? Again, that's not really even a question, more of a thought, but like,
yeah,
I don't know.
It's a good point. It's a bit like sort of the chicken and the egg, like
exactly.
scenario. It's hard to, which I guess just reinforces how important exercise is. Because if someone is already active, they are doing a lot of exercise or they're playing sport, and they're experiencing less symptoms, then it just really highlights how important exercise is. Because whether it is, well, we know there's plenty of evidence to show that exercise does improve depression and anxiety, but the fact that those are the people that are less likely to experience symptoms and then volunteer for an exercise study just further reinforces how important some activity is. And so we've been talking a little bit about the different types of exercise. So we've mentioned a few examples, but another point I sort of wanted to highlight is that the paper, our sort of review, showed that basically any type of exercise was beneficial. So it didn't necessarily have to be resistance training or aerobic exercise, just anything that gets the body moving. So like I said, it could be a sport, just spending more time outdoors. So any sort of unstructured activity that you're getting the body moving tends to be beneficial. And just going back to what we just touched on earlier, as long as the individual enjoys that activity, then that tends to be the most effective or what's most important for that individual.
Well, and I'm glad you mentioned that too, because as I'm reading this, again, I guess maybe reading it from like a prescriptive mindset, you guys have shown that these prescriptions increase or improve this thing. But one of the things that stood out to me was that you mentioned that, yoga and mindfulness as something that might be good for, or you would think might be good for something like depression, but then you guys showed that actually maybe it's higher intensity that might provide a better solution. And I think it kind of goes back to the point you were just making, which is that, maybe if we look at, these meta-analyses, we can tease out some of these causations and correlations. But if the individual who's experiencing depression prefers yoga, maybe that is a better solution, even though in research we see that higher intensity is better. So that one was particularly interesting. And I guess the question I might have for you through that is, based on the findings that you guys have or that you found, are there any corners of the fitness industry where you think that maybe we're off the mark? For example, with the yoga and the depression versus the high intensity stuff?
There's definitely a lot of exercises or types of exercises that have been less studied. So most of the evidence we found was resistance training, aerobic exercise, yoga, and Pilates. So basically, and there were some others. So there was sort of, or different types of aerobic exercise. So the two most common were stationary cycling and walking. And I think walking was most evaluated just because it's so easy to study and so accessible. But I guess outside of those sort of main types of exercise, there's definitely less evidence for other forms of exercise. So that, again, is an area for future research. So there is some studies out there that show activities such as surfing and swimming. So particularly exercises outdoors. There's a lot of emerging evidence to show that when you're exercising outdoors, it is quite beneficial for mental health symptoms. And so, yeah, definitely an important area for future research. And I guess it's just a fact of research studies that those exercises, so for example, surfing, any other outdoor activity, just tends to be a lot more difficult for researchers to study in a research environment.
Sure.
This is a quick one, and the answer is probably no, you didn't track it down because it didn't appear in your study at least, but did you find anything on whether the exercise was done individually or in groups? Was that something that came up at all?
We didn't sort of focus too much on it, but we did sort of notice when we were looking at the studies, particularly we found the studies that involved women with breast cancer who were experiencing symptoms of depression. A lot of those studies used resistance training in group-based settings, and they were shown to be extremely effective. And so that's an important point because the group-based setting, you sort of get two benefits when exercising in a group. You get the actual benefits of exercise, so the physical and the physiological and the mental health benefits of the actual exercise. But then you also get that social interaction and that social aspect. So you're exercising, so those studies that I just mentioned that involved women with breast cancer, you're exercising with a group of individuals who are going through the same thing as you. So they're going through the same treatments. They know what it's like being diagnosed with breast cancer. And so it just provides that sort of cohesive environment where people can share experiences and just get that social participation, which we know is also important for social health, and having good social relationships is important for mental health. So that those sort of group-based exercises sort of you're sort of killing two birds with one stone. You're getting the actual benefits of exercise and you're getting that ability to talk with other people. And often some of the other studies that we saw, we found that exercising in pairs was also quite effective, because particularly if you're going for a walk or you're doing some sort of exercise, any other type of exercise, just having someone there helps make you more accountable. And also you've got someone to sort of talk to. So if you can talk during the exercise, it can often get your mind off the fact that you're doing exercise and help the time pass. So again, that's shown to be a useful technique for people who are experiencing depression and anxiety and mental health symptoms, just having an exercise buddy. So whether it's a friend or a family member, it helps hold you accountable. So often you don't want to skip the session because you don't want to let that person down, but it helps sort of motivate you as well.
So I'll pivot back to when you did actually talk about in the article. And I was surprised that it didn't come out in the conclusions you guys highlighted, actually, because as I look at it, and you can correct me if I'm reading it wrong, but for both depression and anxiety, when you looked at the session frequency, so how many times per week they exercised, it stood out to me that the 4 to 5 sessions, which you guys classified as the medium frequency, significantly outperformed both the low frequency and the higher frequency. So it didn't behave like intensity, where the higher you went, the better it got. It had a sweet spot at the 4 to 5 sessions per week. That stood out to me, at least. I'm curious why that wasn't one of the top line conclusions necessarily.
Yeah. So with the discussion section, we ended up having to cut out quite a few words because there's word limit requirements for the journal, but it definitely is an important point, and it goes back to that sort of optimal frequency. So we think that the reason we found that sort of moderate amount of sessions a week rather than sort of exercising every day, we think it's just more manageable. So if someone does have a busy schedule and they've got a lot of things on, trying to exercise every day of the week can become unmanageable and difficult for them to fit in. Whereas aiming for maybe 5 sessions a week is just something that is more achievable for individuals, and they're still getting their exercise. They're still able to do maybe 150 minutes a week. Yeah, so that was sort of the main sort of take home, or the main sort of discussion point that we had around that is just the fact that too many sessions a week is just too difficult for a lot of people to fit into their daily lives.
Mm-hmm. Do you think that, and you guys talked about folks with depression and anxiety and having comorbidities, the comorbidities improve with physical activity too. Did you get any sense with I guess maybe the effect sizes that you looked at, the studies that you looked at, kind of the importance of being able to attack with exercise some of those comorbidities and the effects that that has on increasing, or not increasing, but improving depression and anxiety? Like, hey, I came into this depressed and overweight. Exercise improved my depression, but by virtue of losing weight, I also find that I'm less depressed too, if that makes sense.
Yeah. So that was hard to sort of disentangle, like
Sure.
what's sort of causing what. But we found with a lot of the studies that involved, so for example, the studies that involved women with breast cancer, HIV, we had sort of Parkinson's disease. A lot of those studies were designed to address other outcomes. So mental health outcomes weren't the primary reason for running that study. So maybe, so for example, the studies that involved people with HIV, it was more about improving their quality of life. And then they just so happened to measure depression and anxiety. And we found, so in people with HIV, their quality of life improved. But when we also looked at depression and anxiety, that also improved as well. So it's sort of hard to disentangle what's causing what. Is the reduced depression helping improve other outcomes, or are the other outcomes improving depression or anxiety?
Mm-hmm. Well, I mean, I guess it's not to jump in, but like, would it even really matter if you needed to tease those out? Because, you're kind of like, I think it all kind of, for me, circles back to this conversation around like, hey, exercise can be a really powerful prescriptive tool if you do it well.
Yeah, and it sort of goes back to that point. If they've got comorbidities and they're exercising, and they, let's say, for example, a particular individual doesn't see improvements in their depression, whereas there's a good chance that they're going to experience other additional health benefits. So even by exercising, if they just see very small improvements in their self-reported ratings of depression, well, that might be the case, but also they might have, in the meantime, improved their strength, improved their self-esteem, reduced their risk of other chronic diseases in the future. So even if we don't see improvements in one particular aspect or one particular outcome, there's a good chance just by exercising and being active that they're going to experience a whole range of other benefits. And so, again, like you mentioned, it really just highlights the importance and the power of exercise.
Yeah, no, totally. And I guess working towards a close here, and maybe asking you to step outside of your scope slightly and just more of an opinion or maybe a thought, because you've clearly looked at a lot of research in this space. We talked about it at the beginning, like this isn't surprising, right? That exercise is good for your mental health. So why do you think that, the medical industry, the pharmaceutical, geez, that's a word, industries, why do you think that they continue to avoid this type of treatment despite overwhelming evidence that shows that it's good for you?
Yeah, it's a difficult question, and there's a lot of different factors that might be at play. So I think one of the main ones is often, like we said before, doctors in particular are often not trained well enough to be prescribing individualized exercise prescriptions. So a lot of them might understand the importance of exercise, and they just provide a general recommendation. They'll just tell their patients to go and exercise for 30 minutes a day, and then that's it. So often providing that one-on-one support to someone who's a trained professional might be difficult. And also the fact that I think, as I sort of mentioned earlier, often easier for someone with depression or anxiety to just go to sort of taking medications because it doesn't require any sort of physical effort. Often there's barriers associated with exercise. So, like I've said, those people who need exercise or that need to be exercising for their mental health or for any other condition, they tend to be the ones who might be experiencing a whole bunch of barriers that might make exercise difficult for them. So it could be a lack of motivation. It could be the fact that they've never exercised before in their life and it's just something that they've not got any interest in doing and something that they might have negative attitudes towards. So if it's something that they're not accustomed to, and so there's a whole range of different reasons. And yeah, it's a difficult question. And again, I sort of don't want to step too much outside of my scope.
I'm putting you on a public, well, because the other thing, there's well, this is maybe getting me in trouble, but like certainly there's a financial component to the, you know what I mean? Like there's a financial argument to be made. Exercise is, arguably free, but it's $1 million question.
There's sort of less incentives, for prescribing exercise compared to the money that can be made off prescribing medications, for example. But I think the key thing is that, like I said earlier, that there's a lot of people that do benefit from medications and other forms of treatment, such as different forms of therapy. And they do have an important role in treatment for a lot of people. And it's not about exercise replacing those treatments. It's about exercise just being included in the conversation when a doctor is recommending treatment options for those individuals. It's saying maybe we can suggest some lifestyle changes and you might sort of continue some medication. And then over time, maybe they reduce their doses of their medications. But again, like a complicated question and sort of many factors at play.
If you had the answer, you'd be a bajillionaire. So yeah.
So I'll ask one to kind of close this out because we've taken an hour of your time here. But as I look at previous work you've published before this paper, it's been very much in the space of like physical activity interventions for particular pathologies and things like that. And I could be wrong, I don't know here, but it seems like compared to a lot of that work, this one has like taken the media by storm to a certain degree. Like I've seen tons of coverage of this. With like keeping in mind the impact this kind of thing has had on the conversation, where do you go next from here? Like what is the next thing you want to look at? What else do you want to study? Where do you want this conversation to go?
A good observation. So particularly with this work, I think it's all well and good to say that exercise is beneficial and it's something we've all known. But the challenge is, as we alluded to earlier, is actually implementing it and getting people to exercise is sort of the next challenge. And how can we actually do something with this work rather than just telling people exercise is beneficial? How do we actually get people active is sort of the real challenge. And I think the real question. And so that's the direction we sort of want to be heading with in terms of our future research, is just thinking back to those individuals who experience severe depression, they struggle to get out of bed, those ones that are less likely to volunteer for an exercise trial. How can we get them active? So what resources and support can we provide them? Is it that they need access to a trained exercise professional to work with them closely for a period of 12 weeks? Is it better access to resources? So maybe they're living in a neighborhood or an environment that doesn't have safe places for them to walk, or they might just sort of lack access to a gym. Whatever it might be, I think it's just identifying how we can engage those individuals and get them active. And I think sort of going back to, I guess, both your research areas is, I think there's still a lot of work to be done in particularly veterans as well, because we know, particularly once individuals retire from the military, the rates of depression and anxiety can be quite high. So looking at specific populations, so we found that there were a range of different clinical conditions that were included in our review, but there were quite a lot of subgroups of the population or groups of individuals that were less represented. So veterans, for example, there's a lot of research that can be done there. And I think part of the research question is that it doesn't necessarily need to be exercise. It could be any sort of physical activity. So it could be looking at other things such as it might be golf. So we know that can be quite beneficial for mental health. It could be jiu-jitsu. What other activities out there that people want to be doing so they can help improve, so they can sort of get that participation in some form of physical activity, but also experience the mental health benefits of that as well. So there's plenty of directions that the research can go, and I think it's just about sort of slowly chipping away at that research.
Mm-hmm. I guess before we let you go, before we let you sign off, talking about emerging research, your work, your body of work, where would you direct people who want to find out more?
In terms of the research that I've done?
Yeah, your body of work. Yeah. Where can people find out more about what you guys have done and what you're doing now?
Yeah, so I'm currently at the University of South Australia. And I've got a Twitter account, but it's a mix of just professional and unprofessional stuff. So probably not the best person to follow. It's Ben Singh PhD, or at Ben Singh PhD on Twitter. But I'm sort of happy to even just sort of sending me a message on Twitter, happy to sort of talk further about my research and what I've done. And even just sort of a quick Google search, I think brings up a list of some of the research that I've done as well.
Perfect. Well, again, thank you for tuning in from all the way across the world. The stuff that you've done is fantastic. And I know a lot of people are going to be interested in hearing more.
No, thanks. It was a pleasure to be on, and always happy to talk about our research. Thanks.
Yeah, thanks, Ben.
Hey, Alex, let's cover our ass real quick.
Oh, great idea, Drew. All right, guys. The views and opinions expressed in this program are those of the speakers and do not necessarily reflect the views or positions of any entities they represent.
Thanks for tuning into this week's episode. Before you go, please rate and review the pod on the listening platform of your choice. You can also visit us on our website at www.mopsinmos.com. That's mops, the letter N, mos.com. You can check out the library of podcast episodes, our latest blog entries, any helpful resources, and also sign up for our newsletter.
Drew nailed it. Just to underline a couple of things, the podcast entries have in-depth show notes on the website. So if you missed anything or you want to read any of the research we talk about, it is all there. You can, at the bottom of the website, sign up with your email and receive future updates from us. The blog posts go a little bit more in depth in kind of written form on a couple of topics we get questions about all the time. But most importantly, I just want to ask all you guys, our best way the word gets out is absolutely word of mouth. So tell your friends, tell the people you work with, anybody you think would find it useful. Thanks for spreading the word.
If you have any questions or comments, feel free to shoot us an email at either Drew or Alex at mopsinmos.com.
Or there's a contact form on the website.
Thank you.